I'm Dr. Satish Tiwari from Amravati, Maharashtra, Founder President, Indian Medico Legal and Ethics Association, and we are working on the improving doctor-patient relationship, ethical issues in medical practice, and medical negligence. We personally feel as a medico legal consultant that the relationship between doctor and patient was of a trust and of faith. Almost so much that a doctor was supposed to be the god or semi-god. But what happened eventually, gradually, the relationship started widening, as you rightly said. This relationship of trust is now becoming mistrust, and there is a wide variation in the feeling of the patient and the doctor that both are not performing their duties properly. Patient feels that doctor is not doing his duty properly, he is busy with many other works, with his family, and doctor is feeling that he is not getting time for the family and for the friends and all this. So this gap is widening gradually, but at an alarming speed. So we have to look into how we can decrease this, how we can restore the faith in the patient in the doctor, the confidence in the doctor, and the doctor's faith or the doctor's belief in the patient. We again feel that if you remember one, there is a say in Hindi, ताली एक हाथ से नहीं बजती है. So we feel both are equally responsible. As we said, the patient nowadays, he has lot of money, maybe through the earnings we have 6th pay, 7th pay commission coming up. There is a lot of insurance companies coming up with taking premium for the treatment and then giving the money on behalf of the patient. So patient does not have to pay from his pocket. There are many government schemes where the government is going to pay the money. So patient is not worried about the payment now. What he is worried about the outcome. So that's why there is a increasing accountability on the part of doctors. There is soaring expectation on the part of patient. So that's why patient feel that if I am paying money, I can buy the life. But at the same time, if you look at the doctor's point of view, the treatment may not be 100% perfect in each and every case. Most of the time, the court have also agreed that the treatment is the role of the doctor, but the outcome is in the hands of the God. I think if you remember again, there is one of the most known epic of Hindu mythology, that is Ramayana or Ramcharitmanas. There is a say again, there is a doha, Hani labh Jeevan Maran jas ab jas vidhihat. So that's why we feel that if we believe in Hindu mythology, so Hani or labh or Jeevan or Maran still is in the hands of the destiny. So I think doctors are not 100% responsible for the poor outcome. At the same time, patient should not have unexpected outcome or unexpected treatment miracles from the doctors. So if you can do this, if you can bring some coordination between the doctor and patient, then all these problems can be solved. This is a global phenomena, and I think we have the bad habit of following the Western culture. We forget our own culture. We always keep on saying that India is a developing country and the Western world is a developed world. So if we want to develop, we have to follow whatever the Western culture or the Western countries are doing. So here also I think what we were saying about the insurance things, the concept of insurance or the premium related health care is we have taken from the Western world, and that's why we are now as usual following the Western world in the medical treatment also, medical health care also, and because of all this whatever was happening in United States or in United Kingdom is now happening in India. I think again what you ask is a very vital issue, and what we feel personally, the ethical fabric of the medical practice has been totally distorted. We say it is totally torn, and ethics we are forgetting. Ethics we are not following in many cases. But again, for this I would not like to blame the doctors. Though we feel that the practice is becoming unethical, we feel personally again that for this everybody is responsible. The society, the community, the media, the police, even the judiciary, everybody, the government, and I think somewhere we have to have a coordination between all of this. If we know that particular doctor is ethical, it's the role of everybody to protect him, because then only the doctors will follow ethical practice. But if we go on doing ethical practice and we are not getting the same response from the community and from the media and from the government, then I think somewhere we have to think whether we should do the ethical practice. Should we worship the goddess Lakshmi or should we worship the goddess Saraswati? Or we have to have some balance between the two, between the Lakshmi and the Saraswati. I think you have again raised a very vital issue. The ethical practice or the practice with minimum expenses, as we said from the beginning, the role of commercialization is very much there. We feel that the commercialization has led to the unethical practices on many occasions. We have come to know that there is a target based medical practice in corporate culture. I mean, the doctors are given some target that you have to admit this number of patients. They are given target that you have to perform this number of operations. Otherwise, one of my friends says that we were told that if you cannot do this number of operations, then you please leave our hospital. There are so many doctors standing in row to join our hospital. So I think somewhere there has to be restriction on this. The medical practice should be patient's need based and not the target based, or the corporate hospitals need based. It has to be the need of the community, their requirement and their health priorities. And somewhere government has to look into this. In our country, government in most of the states, they have promoted private medical colleges, where we feel that the teachers, many times the medical teachers, they are now being labeled as a ghost teachers. That means they are not there in the college, they are only on the paper, and they come only on the day of inspection, and rest of the time they are not there to teach the students. Then if we look at the patient's point of view, the most of the doctors now are the disposable doctors. So what they do, they will go to one hospital or to one doctor in the morning. As I said, they have a lot of money, they have a lot of expectation from the doctor, from the medical treatment, and by the evening if there is no response, they feel that this doctor is not competent and they change the doctor. So that's why we say nowadays the doctor have become the disposable doctors. The patient will go on changing the doctor for getting expected result, which many times is not possible. So this privatization of medical colleges and medical education in the private colleges has resulted in many problems, as we have discussed, that if this student is paying amount in crores, then he has to recover, because he has to pay the interest on the loan, he has to take out the amount which otherwise he could have got kept in the bank and then got the interest. So now he has paid. So that's why the unethical practice is increasing. That's why we feel that the corporate culture is increasing, and gradually the health services are becoming unaffordable for a common man. I think again what you are saying is a multifactorial. It cannot be a single factor that because they are government colleges they are bad, or because it is a private college or the private institution it is a very good institution. Again, as we discussed, in government colleges there are many problems. There is a problem of not only the teachers but the problem of infrastructure. And government, as you know, in most of the cases is now following the privatization, public-private partnership. So I think they are feeling that this also is not possible for them to run the medical colleges in a proper way with good infrastructure. And the private bodies, most of the time they are related to the politicians who form the part of the government. So I think they have tried to make it as a what we call the political heavyweights. So they are trying to have a earning source for their lifetime. So most of these private colleges are run by the politicians. They form the backbone of these institutions, and they feel that this should be the private hospital should be good. But where we have a sincere, ethical politicians and government servants, we get a good hospitals and the good colleges. But at the same time, where there is a problem of, as you know, there is a lot of corruption, everybody is talking of corruption. So medical health services are also not free of corruptions. So probably somewhere again the government, the policy makers have to look into to tackle this corruption in the government as well as in private. Then only we can have the proper setup in the healthcare services. So how to do this, we have to discuss, we have to decide with the policy makers. We feel that again it cannot be single sided story. As we know, the coin has two sides. Similarly, the pharma and doctors are two sides of the same coin. Both are interdependent. Nobody can go single-handedly. So there has to be some relationship between the pharma and the doctors. Agreed. But this relationship is again has to be ethical. This relationship has to be unbiased, and they should work for the benefit of the community and not for the benefit of the pharma or the doctors individually. I think at present what we are seeing in the community is just the opposite. The doctors and pharma, they are working for each other and not for the benefit of the community or the patient. So pharma company, they try to give inducement to the doctors, and doctors go on writing many times medicines, vaccines, which are not required basically. And I think again when we look into the history of all this, we are again probably trying to follow the Western world. The many vaccines which are manufactured in the foreign countries, Indian population is used as a guinea pig. So this is well accepted fact now that they produce the vaccines, but because they do not have the population and the population explosion is there in India, they are trying to use that vaccine to know whether if there is a side effect, whether it is effective or not. So the Indian population is many times used as a guinea pig for the clinical trial by the pharma companies. So this I feel is unethical. This I feel is bad for the society. So this has to be looked into. Again, the government plays and the policy maker, they play a very important role. The medical council has a lot of work to do in this direction. But at the same time, I feel the pharma companies and the doctors, if they work together in an ethical way, they can do much more for the community. Definitely what you are saying is very correct, But at the same time, we forget that we always talk of corruption. So in our country, what is the problem? We have laws, we have various enactment which can control all these nexus, but the implementing authorities are not doing their work properly. So somewhere we have to look that the laws are made, but those laws are also implemented. So I feel as most of the laws in India are not implemented. We have law for almost everything. I think if I want to give the example, we have law for not smoking in the public place. But how many of us are following that? How many of us are penalized for that? If you see in a movie or if you see in a television, they will show smoking and then write a small caption at the bottom that smoking is injurious to health. Similarly, we have law about the helmet, we have law about the seat belt, but how many of us are using all this? So, law can be there for preventing the doctor-pharma nexus, but the role of policymakers in implementing, we have failed badly in that. That is not happening. That's what I am saying. It's because of the corruption. It's because of the corruption in the implementing authorities. And as we said in the beginning, that if a doctor is ethical, he has to be protected. In many times, what happens in many situations, the ethical doctor is penalized, and those who are really doing unethical practice, they get away because of the corruption. So I think somewhere we have to look into this aspect also. We have formed this association with the aim of improving all this what we have been discussing in last 10 or 15 minutes. We have found that there is a lot of problem with the, as we said, there is a widening with gap gradually widening between the doctor patient relationship. The doctors do not have time to talk to the patient. They are busy with the patient, or those who are not busy with the patient, they have many other activities. So the doctor patient relationship is gradually distorting to a very bad extent. So that was one aim. The cases of medical negligence are increasing, and the patient are now trying to take the law in their own hand by attacking the doctors, by attacking the hospitals, and by going to the court of law. Again, we feel that this may not be totally out of context, but this is not the solution. The solution is something where we can have a coordination between the patient, between the doctor, and the policymakers. So what we are doing through this association, we are trying to create awareness not only amongst the patient but also amongst the doctors. We are educating our colleagues also that how we should talk, how we should communicate with the patient and the relatives, how we should maintain our document. It's very important. In the most of the court cases, it is the documentation which is going to decide the case. It may be in the favor of the patient or it may be in the favor of the doctors. But if the proper documentation is there, then only the case will be decided in the favor of the doctors. So whatever is done, it has to be documented. If we are performing some operation, we are doing some procedure, a proper consent is to be taken, and all this we are doing through our association. We have come out with the textbook on the all these medico legal issues. We are having quarterly journal, and now we are planning for the diploma courses on medico legal issues. So we want to create a healthy atmosphere as far as the health services and health sciences are concerned.